Ode na isumbwa DVB.
Aye. Anikadate much.
Anikadate omukulu wambi. Amba kubwera. Fika hapo.
No, we're going to piece it.
1 2 1 2 1 2 1 2. Sit up.
Good afternoon and a warm welcome to this Scotland-Malawi Partnership SMP meeting on COVID-19. Everybody is equally welcome today, whether or not you're entirely new to us as a civic society network. We're funded by but independent of the Scottish Government and work to support, connect and represent everybody involved in the dignified people-to-people relationship between Scotland and Malawi. We're delighted to have senior figures in both nations joining us today, including the Deputy High Commissioner in London, the Chief of Health Services in Malawi, the Honorary Consul in Scotland, the Chair and CEO of MaSP, and the Deputy Director for the country in Malawi, all protocol observed. Across today's meeting, everybody has an equal voice and is equally welcome. So once we've gone through the questions and points submitted in advance, as everybody was invited to do at registration, please do speak up, offering brief questions and comments. Please don't be offended if I need to ask you to bring your point to an abrupt conclusion. Concision and the briefest of summaries and questions will help us to hear from as many people as possible and cover as many topics as we can. We have a full agenda today, which has been shaped by SMP members and their partners, and by participants in previous Scotland-Malawi Partnership online meetings, those of our sister organisation in Malawi, MaSP, and the meeting which was co-hosted between our friends at the Scotland's International Development Alliance and the SMP. We're all centrally muted right now. We'd ask everybody please to remain so until invited to provide a contribution. To unmute ourselves, we click on the microphone icon at the bottom left of our screens, which has a diagonal red line through it when it's on mute and no line when unmuted. We'd ask everybody please also to keep videos turned off, just really for the stability of the line, which we understand helps. Please do use the chat function to make points also, especially when there's not time for these to be verbalized. You can communicate with everybody on the call using this function or hover over it to use the drop-down list to message individuals privately to pursue points with them. If you're happy for your email address to be shared with everybody in the meeting, do please type that into the chat function now or during the call. There's absolutely no pressure to do that, but it's useful for people to be able to keep in touch. My name's Stuart. I'm on the staff team of the Scotland-Malawi Partnership, and will be facilitating this meeting. Our Chief Executive, David, will speak shortly on the advocacy sections and provide summaries of key points and actions arising from this call. My colleague Craig is making the Zoom technology work, and Gemma Conley-Smith is doing our social media. Please feel very welcome to tweet about this meeting during the course of it. And the Twitter handles will be typed into the chat function. Today's meeting will focus, as before, on seeking to support SNP members in Scotland and to hearing about the situation in Malawi, trying to build as full a picture as possible of the realities of the situation for everybody in these countries. But unlike previous meetings, it won't be divided into the two sessions on Scotland and Malawi. Turning to the agenda, section 1. This section looks to brief members on the situation in Malawi by listening to and having an opportunity to ask questions of Dr. Charles Mwansambo, who is Chair of the Health Cluster of the Government of Malawi's COVID-19 Response and Chief of Health Services. Section 2 will look at the 7 main agenda items proposed by members who booked places: understanding the political context, PPE availability and production, testing, public messaging, how faith links can and are supporting, how those with disabilities, the marginalised or the vulnerable are affected by COVID-19, youth and schools, and safeguarding. Section 3 will discuss the implementation and promotion of the agreed principles of good practice for practitioners, NGOs and funders. Section 4 is an open space for organisations who've registered a wish to share an update about how their organisation is responding to COVID-19. And finally, in the next steps, we'll look to agree 3 key recommendations which we hear from you for the SNP to take forward for its members. We may hear a little more today from and about Malawi. This isn't to downplay the gravity of the situation in Scotland and the UK, but briefly to share a sense with our friends in Malawi of the situation here. 15,524 confirmed cases of COVID-19 in Scotland, which is including 53 new cases reported yesterday, June the 2nd. It's worth noting that these stats are from the Scottish Government's COVID hub. The hub mentions that confirmed cases are an underestimate due to various factors. In terms of the situation, how things are progressing in Scotland, as of the 28th of May, the Scottish Government advised that Scotland is at phase 1 of a 4-phase route map for moving out of lockdown. This means that there's still limited shopping trips, social distancing in place whilst out. The main change really is the allowance for us to socialise with members of one other household of up to 8 people in a gathering outside whilst maintaining social distancing, and to travel in order to exercise. Scotland's approach and restrictions are more cautious than other parts of the United Kingdom. For example, some schools in England and Wales reopened on Monday, but the First Minister in Scotland, the equivalent of Scotland's Prime Minister, Nicola Sturgeon, has announced all Scottish schools will reopen on August the 11th. In the UK, the number of deaths from COVID-19 is 39,693, with 324 cases reported yesterday. Although overall there's been a downward trend over the last few weeks, this has stalled with 1,630 new cases reported UK-wide yesterday. Participants in previous meetings, I think it would be fair to say, have been surprised at the relatively low numbers, low official numbers of COVID-19 incidents in Malawi. And we're certainly keen to hear from experts on this call in a moment. But our understanding from the Government of Malawi Health Ministry COVID dashboard is that the number of deaths in Malawi is 4, the number of recovered patients 42, the number of suspected cases 5,688, confirmed cases 358, with the direction of travel also seeming to go down. But again, purely reflecting the note of caution reflected by participants in the previous 4 meetings about official statistics, whether this is due to disease surveillance, monitoring, and the scale of testing. It's a pleasure for us to be able to invite the Chief of Health Services in Malawi, Dr. Charles Mwansambo, who's also the chair of Malawi's COVID-19 response unit, to share a short update with us. Dr. Mwansambo.
Thank you very much for giving me the floor. I understand I have to do this in 5 minutes, so I try keep it short. So, I missed the introduction because I was in another meeting. I just come out for this one. I won't be long. I've shared my presentation with Stuart. So if you could project that, please, to just share with everybody.
Has that been shared by email, Dr. Mwansambo?
Yeah, but via email, yeah. Yeah, sure.
Okay. No, I'm not in that at the moment, so there might be a short delay while I try to find that. I wonder
okay, then I'll try to connect it from my computer then, if you don't mind. Let me see if I can get it.
Yeah, that'd be great.
Hello, I think you've disabled all the sharing, so it has to be from there.
Okay, let us look.
If you don't mind, I can quickly talk about it and share the slides later, if that's all right with you.
That would be very helpful, thanks. Yes, please.
Okay, just to say that since I only have 5 minutes, Malawi is equally hit but by the pandemic. And if you're looking at our update from today, from the figures we got yesterday, we have 22 new cases, and cumulatively we had 358 cases. Total active cases as of today is 303, because we have nine new recoveries, bringing the total of recoveries to 51. And we are still at 4 deaths. And tests conducted so far is 5,505. So I must say here that our approach is slightly different from the UK in that initially we were concentrating on the symptomatic people plus also their contacts. And recently, since after South Africa eased off their lockdown regulations, we've seen a number of Malawians returning to the country from South Africa. And unfortunately, the positivity rate for those is very, very high. So the other ones that actually pushed up our figures to where we are now. Because from people coming from South Africa alone, we've registered 210 positive cases out of 1,364 that came in through our border. So those have changed our epi curve significantly. So at present, the public health measures we're taking is rapid identification, diagnosis and management of the cases. And we're also following up the contacts. We're doing health prevention and control in healthcare settings. And as I already said, we're actually screening all the travelers that are coming in and raising awareness in the community, and also a lot of risk communication. Because at present, quite a lot of Malawians don't see the COVID as you are appreciating it in the UK. I mean, we've had the 4 deaths, but apart from that, most of the other cases have either been asymptomatic or just mild. So they haven't seen the dark side of COVID. So our messaging has to go out strong to say that we need to expect the worst. In terms of response pillars, we have the coordination pillar, surveillance and point of entry screening and follow-up. We have the laboratory and diagnostics. We have the clinical case management. There's a group looking at infection prevention. Another pillar is supply chain and stockpile. I've already talked about risk communication, but there's also resource mobilization, budget and financing, issues around infrastructure, human resource, and finally research and development. That's where this link comes in handy. Among the public health measures that we're promoting, as you may be aware, Malawi was planning to go into a lockdown on the 18th of April, but there was a group of civil society organizations that went to the courts and got an injunction against that. So we didn't go into a full lockdown. So without a full lockdown, the other measures we put in place included reinforcing regular hand washing with soap and running water, plus also using hand sanitizers if you can afford. We've been promoting the issue of social distancing, and for Malawi, we adopted the WHO 1 meter. I know the UK is currently using 2 meters, and CDC is promoting 6 feet. So, but as a country, we've stuck to the 1 meter physical distancing. Another tradition we had in Malawi is that of handshaking, and this too we've discouraged completely, and Malawians are no longer shaking hands. The other issue is on self-quarantine. I mean, we, unlike elsewhere where they're institutionalizing all positives, we've allowed them to be at home and just be followed up by the healthcare workers. And then we've also been we've actually discouraging crowds. In fact, the current limit was 100. In fact, we're planning to bring it down to 10 when the politicians started their campaign. So we actually stuck now because our campaign is being led down by the current campaigns that are going on for the presidential elections that are coming. For those that have symptoms, we're encouraging to stay at home, and we are recommending face masks when you're going to places where you cannot observe social distancing. We haven't made it mandatory, but we strongly recommend the use of face masks when you're out in the public. And then, of course, we've encouraged to keep away those that in the at-risk groups, like the elderly and also those with chronic conditions. I'll stop there for now and take any questions you may have. Thank you.
Thank you very much, Dr. Mwansambo. In fact, Professor Mipando, if you're willing to give your update, then we'll move to questions after that, please.
Thank you, Stuart. For me, it's a short one. Actually, I could have loved Charles to spend much time because it's rare that we get him here. But just to say, as a college, we are still supporting the response by the ministry. We still have our 3 main subcommittees, the public health one. This is working closely with the Blantyre DHO, the surveillance, and also in preparation when we are having returnees from South Africa. I think you are aware a lot of the tests were done in Blantyre. So we have been involved in the testing together with the DHO who's providing the leadership. We are providing the diagnostics and even the preparation. Every evening we have what we call as a situation room where College of Medicine, the DHO for Blantyre and the mostly the Queen Elizabeth Hospital, we do discuss what has transpired, what are we doing in terms of follow-up and others. We are also helping with the surveillance in specific areas that we could do. At the college itself, we are providing the college as a space accommodation for any healthcare worker who has been found to be positive or suspected to be exposed. We are providing accommodation at the College of Medicine. We are also providing some logistics that are needed with Queen Elizabeth. I must say also in terms of research, there are quite a number of research proposals that are happening. We, through our IRB, our Institutional Review Board, or what we call as College of Medicine Ethics Review Board, we have, with the help and the support of the National IRB, we are expediting the processes of any research proposals that have to do with COVID to make sure that it has to be ethical, but at the same time, the turnaround time should be faster. We are also looking at the teaching in terms of the teaching itself, because you are aware we had 8 weeks to go until the end of our academic year. So we are in the process of teaching our faculty to use what we are calling as emergency remote teaching, not complete online, but we have taken the things that we can teach online, and so that we should have only the remaining practical ones when the students do come. So our hope is that by the 15th of June, we will start implementing that. Our fear, we are still discussing with the service providers, TNM and Airtel, to see that our students can have 0 rating when they are accessing our website, because we are aware that there is a digital divide somewhere in the rural areas, so we don't want to leave out any student in there. We're still in the process of trying to find resources, because we have 23% of our undergraduates who don't have internet-enabled devices, either tablet or a smartphone or a laptop. So we're still engaging the stakeholders. We have had support from the private, in our case, Puma, which in the past or in other countries used to be BP. They've donated fuel for our lab and also PPEs. Our national bank, which is I think the biggest bank in Malawi, has donated PPE and other resources to be shared by College of Medicine, Queen Elizabeth and Nzuzu and Zomba to the tune of about 10 million. And even EcoBank also gave us funds for the laboratory as diagnostics. We are very supportive of the government and our members of staff. They are working with Charles' team. I think you are aware the co-chairman is our dean. He was once here in this forum, but also Charles has other what I can call as groups that are specialists and like public health. Part of our members are part of that. We are looking out to see how much more we can support. So even at the university level, we've sent our people to work with the university. The chairman of the University of Malawi response team is my deputy, and our members are part of that to look at if we have to restart, because there is a proposal that schools should restart in July, but we are trying to provide evidence and scientific reasoning on when and how to do that. So we are also busy with that. I think I would stop there. I would want to give more time to Charles because he's not here most of the time. Otherwise, I do attend, and I'm thankful that you could invite me. Thank you.
Principal Mipando, thanks very much indeed. Conscious, Dr. Mwansambo, of your time, and keen to get to some of the questions and to provide an opportunity for those to be aired and for you to be able to provide a response. Perhaps if I could offer the first 3 to you, if you're happy to handle them in these segments. The first from Heather Palmer: how's Malawi going to deal with social distancing during the upcoming election campaign and process? From the CEO of MaSP, Vera Kamtukule, Dr. Mwansambo, some returnees were reported to have left the quarantine camp. What's the impact on this regarding the spread of the virus? And how are you dealing from Action Amos? How are you dealing with refugees and persons with disabilities as they're vulnerable?
Thank you very much for those questions. I'll go in the order in which they come in. I mean, the elections are quite a challenge because our political leaders are supposed to be exemplary. And we've engaged them through the Presidential Task Force on COVID-19. But it's still quite a challenge. In fact, if many had it their way, they said, well, let's move the elections a little further until we sure that that things are fine. But obviously now that they're here, we're just trying to encourage the political leaders to encourage social distancing, but it's not possible. And that's a major setback to our fight against COVID at present. But to do everything possible to not to give in, but keep sending the messages to them to make sure that they follow whatever we advising them. So that's a big challenge. The next question is on the escape from the stadium where we kept these people. I just want to make it clear that this was not a quarantine center. This was a place where we'd identified for these returnees to wait for their COVID-19 results. So indeed, initially when they're at the border, they were told that the results would come out in 8 hours, but because of the large numbers of the samples, the results took a little longer. So some of them got impatient and left. But the good thing is that we had all their contact details. I mean, and some of the passports were still with immigration. So we passed on their names and results to the district health officers who are following them up. But it's a bit of a challenge for some of them because they come from South Africa with no local numbers. So most of them put in their contact numbers. So for some, I think we've had problems that they haven't been able to get them. But we hope that using the surveillance systems, we'll be able to get to them. But the message is that we're putting out on radio and to everybody is to observe the social distancing, avoid the crowds and all that. So I hope by so doing, we'll be able to get over the 14, 21 days so that they don't pass infection to as many. But it's still a potential risk that we closely are monitoring. There's also another issue of how we're dealing with the not the underprivileged, but special groups. Well, there's a team in the health education unit that's preparing MESS appropriate fora to get to these people. I know we had challenges with the Braille, but I guess the team is working hard so that we don't leave anybody behind. I'll stop there for now.
Thank you. A question that's come across very clearly and consistently and forcibly from Malawi and friends in his previous meetings, Dr. Mwansambo, has been the issue of messaging and getting the message to rural communities where it's been reflected that life has been continuing very much as normal. We've heard from Ekwendeni and other parts of Malawi where they're saying messaging just isn't getting through. I wonder if you would kindly address that in a moment. And then other questions coming in from Sue Kevin, the Raven Trust. What's happening in the College of Health Sciences? Support from Caroline Beaton about the importance of political leaders needing to be exemplary. Chisoma Banda, Dr. Mwansambo said earlier the number of people in gatherings may drop down from 100, but at schools we know there are many more than 100 people in attendance at any one time. Why are schools set to open despite that reality? Michael Beresford, can you please comment on churches continuing to meet and worship? Ostensibly with a limit of 100 people, we've seen churches continuing to arrange induction services, which are many more than 100 attending. It seems difficult in the current climate to persuade churches to stop meeting. And then finally, for the moment, to date, are the central hospitals resourced sufficiently, sorry, my screen's moved, both in terms of equipment, PPE, and staff numbers to meet the surge in capacity? That's from Dr. Barry Clatton at the NHS Tayside. Dr. Mwansambo, that's 4 or 5 questions.
Thank you very much for those questions. On the messaging, our major setback was, in fact, the 2 things. One is the court injunction on the lockdown, and the second has been the political rallies. I mean, we were all set for a lockdown up until April the 18th. I mean, quite a lot of Malawians were serious, observing all the messages that we were passing to them. But when the court said that, well, when there's that injunction, people unfortunately thought, in fact, somebody overheard some vendor saying that the judge has ruled that there's no coronavirus in Malawi. So you see, from that common man interpretation, it just messed up our whole strategy of the various messages we were putting forward. So the team is working hard with our health. There's actually a communications team designing messages for the community. And we've involved the district councils and the local leaders too. We've actually developed a community tool on community entry and how we can get the community using our already existing systems. So we've put something in place to not to leave the community behind. But the messaging is being worked on by the health education team. On the schools reopening, I mean, I know a date has been set, but that's just a provisional timing. I mean, it's actually, they said mid July. I mean, that's not yet official. It's just being discussed. In fact, this morning, I was at a meeting of PSs discussing the same, because there are a few issues, there's still consultations going on. I know there's pressure from the private schools to get the students back in class, but I'm not sure whether that's for the speaking on behalf of the students and the parents, or they're speaking on behalf of their own pockets. I mean, at present, we knew what was happening with our previous cases, but with the injection of the new cases from South Africa, we don't know what's going to happen in the next 2-3 weeks. So my guidance to the team was that let's wait and see. But you have to play a balancing game, because there's also the educationists on one side and the proprietors on the other, wanting the schools to reopen. But that's the discussion still ongoing. I don't think an agreement has been reached yet. But I agree with you. I mean, if the students are going to go back in class, then we have to follow all the rules, including social distancing and limiting them to make several streams so that people don't crowd. But it's still too soon for Malawi to start thinking of opening schools, because we never went into a lockdown. On the churches, it's the same story. I mean, in fact, this level of the epidemic, we're supposed to, but because the politicians have gone out on the podium, I mean, it's messed up our messages, because whatever message we come up with, people say, what about the politicians at the political rallies? So that's a big challenge, but two wrongs don't make it right. So I still feel that the churches at this time should not be congregating, the schools should not be reopening, and we'll give the appropriate guidance. But we have teams that are working on that, so we rely on their technical guidance as well. As to the central hospitals being ready, that's a very difficult question. It is a question as well, in the sense that there's never a hospital in the world that has been ready for COVID. We are already resource limited, but we try the best we can to put a few structures in place. I mean, HR is still an issue. And PPEs, when we are beginning, with the lockdowns and with the lockdowns in many countries and not many supplies coming to Malawi, we had problems with the shipments. But I'm glad to report that most of these PPEs have started coming in, and most of our facilities, except maybe a few where there are distribution issues, the PPEs are getting there. Equipment, unlike the Western model where we use a lot of ventilators, cases we're seeing here have not needed that many ventilators. But at present, we've actually isolated some places where we may need to give that ICU care if we need to. But just to say that we're seeing a totally different picture from what's happening in the UK and the US, and just pray that it continues this way, that not many people would need that respiratory support. But when it comes to 5, 10, we can manage. Thank you.
Thank you very much. Finally, two quick questions. Apologies again that we're not getting through everything, but we'll share all of these questions that are put on chat with you, Dr. Mwansambo, afterwards, and endeavour to get answers back to this group. There's a question about the reliability, the accuracy of the statistics on COVID-19, and also about the efficacy of testing kits. I wonder if you'd care to comment on these 2 points, please.
Thank you very much for that question. I mean, the statistics, I think you can't question that, because we have a team, and as I said, we have the surveillance team that's doing the work wonderfully. If we have one case, for example, I'll give you a case, the very case that we had in Malawi, one lady who traveled from India. In the compound, there are about what? There are about 14 people. We tested them all. 3 of them, I mean, 4 of them turned up positive. And we actually tested the contact of the contacts and so on and so forth until we got down to 0. And we had another case that came in from Tanzania, the same thing. We first of all screened the immediate contacts, and then after that, we test the contact of the contacts. So we've actually done the best we can as far as contact tracing is concerned. And I think there was a concern in the early days of the epidemic in Malawi when some people say maybe we're not catching enough. But then if you look at these contacts of contacts on contacts, we didn't have many positives in that group. There are proposals at present to do some surveys, just test a few groups, like picking up a few communities. I mean, one community is that of health workers, and then we have some hotspots, both in Blantyre and Longwe, and some rural areas where we're just using antibody tests to see where we are, or to see who had it already. So that would be a true reflection of maybe what's happening in the community. But as of now, I think we're seeing the true numbers. But the main concern is the recent injection of cases from South Africa. And that obviously is a concern, and we just have to see what the next 2-3 weeks will bring. So until now, trust our statistics. I mean, it's not like, we're not like our neighboring country where the figures have not been released for the last 3-4 weeks. I mean, so trust those figures. As for the efficacy of the tests, well, there's a lot of quality assurance. What we did for the first few tests that we did is that we bounced them on this regional lab in South Africa to see how we're doing. And then for even the tests that we're doing, we have a number of molecular laboratories that have, for the first few samples, they have double checked with the other labs. And for the indeterminate results, they actually don't just test them again at that lab, but they'll pass it on to another molecular lab to test it. So for the efficacy and quality of the results, I mean, I can't question that as well. So rest be assured that the results we're getting are very reliable, and I can't question them. We're using the real-time reverse transcriptase PCR, by the way, and we've gotten some, test kits from both the US and also from China. So, and they're working perfectly well. I have no problems with that.
Thank you very much. It sounds like a very difficult situation for you as a medical professional, having to deal with the challenges as you express them around political situations and messages of empathy and really the desire for you to be empowered to carry these through for Malawians who wish to show their support for your medical leadership in that. What can they do to help support your health lead rather than any political dominance that might come as it can do in any country? I think you're still muted, Dr. Mwansambo, sorry.
Oh, thank you very much. Sorry about that. I'm saying this is one such help, but just talking to the team and reassuring us and learning on what other colleagues are doing elsewhere is very helpful. did talk about that research and development arm, and know that there are eminent researchers in the group here that can help us as a country. Human resource is still a challenge, and I know the principal may mention it when it comes to talk about it. I mean, they still need to beef up our teams and see how best we can come up with maybe courses appropriate to the time we're in. Because I'm not sure how long we're going to have this COVID for, but it's not going away tomorrow. So the university needs to be helped to see how it can get to the students, and so that they don't lose out on anything. So I missed the first part of your question, but I hope I've addressed what you're requiring of me.
Thank you very much indeed for your time and involvement. As mentioned, we'll ensure that all of the questions and comments put into the chat section are shared with you, and we'd value your thoughts on these, and we'll share them back into a future meeting. So thank you very much indeed. I'm aware that you're going to another meeting very shortly after this, but
yes. Oh, by the way, you asked about my Scottish link. I was in Scotland first time I went to the UK, and I value my Scottish connection. Thank you.
Thank you very much. That's very kind. Dr. Peter West, Honorary Consul in Scotland, I wonder if you'd like to come in. I know that we're also hoping to hear from the Deputy High Commissioner, but I don't see Quent online.
Thanks, Stuart. Yeah, Quent was hoping to join us, but I know she had 3 other meetings this morning, so I guess she's at one of them. I just want to say quickly on behalf of the High Commission how much we value this session, how much we admire the partnership for having these meetings at all in the time of lockdown, and the way in which the interests of Scotland and Malawi are so carefully balanced in the agendas for these meetings. But most of all, for turning what is really a terrible threat applying equally to our 2 countries into an opportunity for even greater working together, equal respect and support. So on behalf of the High Commission, carry on the good work, Stuart. That was all.
Thanks very much, Peter. That's much appreciated. Well, the meetings are all very much member-led, as I mentioned at the beginning. Vera, I wonder if we might please turn to you for a brief update on the political context in Malawi, some of which we've touched upon.
Yeah, thank you, Stuart. Currently, I think Dr. Mwansambo has articulated a lot in terms of what is happening on the ground at the moment. But I think what I can add to that is that at the moment, the political parties have gone full throttle in their campaigns and pulling large crowds, no social distancing and all that. And I think the general public has been talking about it, but I think it's falling on deaf ears. And it's very funny because even the politicians from the government side that are supposed to be on the forefront championing the safety measures are the ones that are also seen to be doing these things. So I think for me, it's very tricky in that regard because we are going towards an election. And then at the same time, we know that in Malawi, you have to campaign traditionally. And I want to believe that it's the same across the world. But under the circumstances, people have still chosen to go out and campaign normally. So that's what we are seeing every weekend. Sometimes even on a daily basis, people are doing whistle stops, they're having campaign meetings and all that. So that's what is happening. But I think what we don't know is the impact of that in terms of increasing the numbers of infections. So we don't have that kind of report yet. Maybe probably Dr. Mwansambo or the colleague from College of Dr. Mipando can come in to say what's the impact of that. But we're just, I think as a population, we're just scared to say if people are gathering like that without protective gear and all that, the chances of spreading the virus would be very high. So I think that's where we are at the moment. So the other thing is that at the moment, we are still not sure if we are going to vote on the 23rd of June or in the first week of July. That is going to be communicated to us, I think, by the MEC. And until that happens, the campaigns are going on as planned. So that's where we are politically at the moment.
Thanks, Vera. Professor Mipando, I wonder if you'd like to come back on that point about the risks associated with large gatherings.
I think it's sad to see what is happening and people not taking the issue seriously. I've seen some questions in that regard. What we've tried to do as a college is that whatever chance we have, if we are receiving something or we are interacting with media, we are trying to talk as professionals to say this disease is seriously, and even chastising the politicians that they are not taking the issue seriously. So as a college, as people from the technical people, we are worried that people are not taking this seriously. But from our point of view is to still stress the worry that we are stressing without choosing any side, because it's both sides that are there. Our worry is that even when you go into these mass gatherings, when you see them, even in terms of, apart from the political part, I've gone to a funeral, we're still having lots of people not wearing masks and not yielding to the social distancing, probably because of the message that our leaders have sent to say maybe this cannot be taken seriously. At the same time, also, it's I think the issue, Vera might talk more, but the issue of the economic impact of this, because despite that lockdown didn't take place, you still see that there is a big hit on the industry, and not many people, the day-to-day living is not as strong as it used to be. So that also is proving to be a difficult, where people that are losing out are starting to talk to say, if the politicians are doing this, why can't we also do our economic activities so that people are there? There is also a big challenge about the schools. I know we're going to talk about that. So what Dr. Mwansambo talked about in terms of the recommendation, I just wanted, for the sake of the people that are not from Malawi, we have a two-level tier in terms of the recommendations. We have the Presidential National Task Force that is co-chaired by the Minister of Finance and our Dean of Public Health. But below that, there are also other task forces, and one of the task forces is the Education Task Force. And it is this Education Task Force that has recommended to say maybe on the 13th of July, we should open. But it's not as blanket as that. They are saying 13th if particular things are met. And I'm aware, I've just received a communication today where they are asking us as a college to put our scientific reasoning to say what would it take for schools to open. So we are still trying to send the messages, and I think where we can, the professionals, we are trying to support the Ministry of Health. As the college itself, we are also trying to see if we can engage media in terms of special programs where our people can speak about the importance of this. The challenge until now, we've talked a lot through TVs, and not many people do see TVs if you go into the rural. So we are trying to see how we can help in taking the message into the rural masses where they cannot watch what up until now we've been discussing through TV and radio. Thank you.
If I can just come in, Stuart, thank you. The other thing that I mentioned, I think the last time we met, was the fact that what you are seeing at the moment is not happening just now because we have COVID-19. I think it's Dr. Mipando is talking about what they're doing their best as professionals to ensure that they provide the information and all that. But the mismatch there now comes in because there's that kind of lack of trust between the population and the politicians, and it can be even from both sides. So people don't trust the opposition, they don't trust the government, and whatever. And so if an opposition leader stands up and says, they're just trying to find an excuse so that we shouldn't vote and whatever, then the people say, then we're going to go to a public rally, you know? So even if a technician tells us that, you know, this thing is deadly and whatever. Personally, I had an engagement for a cousin 2 weeks ago, and one of my cousins is a medical doctor, and the engagement was happening at close to her house, just another house from where she was. She didn't come out. She said, I will not go, because she's a medical personnel and she knows. And we had over 100 people there. And she says, I'm not going to go. But some of us were just saying, no, you know, because I think it's when the government is producing the numbers, it's just 300 people. And as long as it's just that figure, it doesn't have a name like my cousin or my sister, the impact thereof is not going to be as hard personally to take. So when you take it to the political front, it's the same thing where government now is speaking. Even if they're speaking the truth, it's very hard for people to discern whether that is true or not, even if it is true. So then that compromises a lot of things as we fight this virus in Malawi. And for me personally, I think it's really sad.
Vera, thank you, and Prof Mwapatsa as well, both very much. We had hoped to be joined by the Deputy Director for Malawi of DFID, but she has had a family emergency and isn't going to be able to join us on this occasion. But David, would you like to say a few words, please?
Yeah, absolutely. Thanks, Stuart. I mean, just to say, we've been in contact with DFID Malawi across in the long way over the last couple of months or so. Dave Beer is the head of DFID Malawi. He's been helpful and responsive, and Stuart and I were really thrilled to have a really good sort of 90 minutes or so call with Anthea Kerr, the deputy head of Malawi. Of DFID Malawi. She's back in the UK, as are most DFID Malawi staff. There's only a handful of staff remaining in Malawi. And Anthea gave a really good summary of what DFID's done so far through its existing core channels, but also the £1.8 million of additional funds that DFID Malawi have had, much of which has worked through UNICEF, and I think UNICEF are on this line, and very happy if UNICEF want to say a few words about what some of those funds have been used for. But I've got to say, you know, we, Scotland-Malawi Partnership, very impressed at how helpful DFID had been in sharing that information. I know Anthea was very keen to be on this call, and it's extenuating circumstance at the last minute that have meant she hasn't been able to. But I'm sure she or Dave Beer will be very happy to share more details in writing over the next week or so, and we'll send that out to all of the COVID stakeholder group.
Thanks, David. So yeah, we'll share that presentation. We'll hope that Anthea will join us on a future occasion. And as mentioned, we'll also share Dr. Mwansambo's presentation. Apologies that we weren't able to screen share that at the time. I wonder if we might now turn to our agenda of COVID-19 testing and PPE distribution and local production and adaptation. Professor Mipando, I wonder if you might give us an update on that.
Thank you. Okay, I hope you can hear me. Thank you. So things are moving. I can talk. I don't know whether Tracy is here, but I am aware that at the Polytechnic, they are moving ahead. I've already started seeing shields and other things that they are making, and people are buying and supplying with the Ministry of Health. I'm aware that MaSP, they are also producing a number of things which are used, and I think they made donations in terms of a tap, hands-free tap, and others, and shields. At Zuzu, they are producing sanitizers. From here, from the College of Medicine, mostly, apart from what we are doing, the research, working with University of Glasgow, I must say thank you very much to University of Glasgow, because we've gotten a number of grants that we are working on responding to COVID. Similarly, University of Edinburgh, we are looking at the mental health aspect, working with them. So thank you also to University of Edinburgh. As a college itself, we are also producing hand sanitizers. But what we have done, our hand sanitizer, which follows the World Health Organization, we are supplying to Queen Elizabeth. And also we are giving out, because the co-chair of the task force is our member, he had to ask us to support the returnees. So as they were coming, the hand sanitizers that we are producing from the college, we did supply to them and even to the National Task Force Committee and even into the University of Malawi. I know that at MaSP, they were hoping to set up testing center and other equipment that has been donated from the US. As a college, we are supporting Chancellor College and the MaSP. People are coming to learn from here in terms of the diagnostic aspect, because what we are hoping as a country is to make sure that every district should have testing facilities. As I speak now, Blantyre now has 4, and this became handy last week when we had 600 people coming where we needed to test. So we were able to share it amongst the 4 centers, which is at College of Medicine, Wellcome Trust, at Queen Elizabeth, and the Dream Center. And because of that, despite the slight delay, we were able to give the results. But it also provides checking, because in one particular center, we had a huge number coming out positives. So we needed to double check, and we use the other centers to do that. I am aware also in terms of the gowns and others people are making, and companies are trying to work with the government. But the Malawi Bureau of Standards has set up a task force working together with the Poison and Medicine Authority to make sure that it meets the specific standards that are required for the equipment that will be produced within Malawi. So I think that is fine. And I'm also aware, I don't know if there's anybody from Wellcome Trust. Through the Wellcome Trust, they gave funds to our affiliate of the college, which is Malawi Liverpool Wellcome Trust. And I'm happy to report that 2 days ago, an oxygen plant arrived from South Africa, where we will be able to produce oxygen at Queen Elizabeth Central Hospital. And this is a big machine, and we are thankful to the Wellcome Trust that they were able to support us on that. There are also some IT people that are supporting the Ministry of Health in terms of tracing and tracking. And we are seeing, we are hoping that people can use that. And already in terms of smartphone applications that they have developed for people to check, to be able to see where they are, that has also been a very great initiative. So we are working. And lastly, maybe I might say this, as a college, we are hoping that within the next 3 weeks, I've asked my Dean of Postgraduate and Research, and also our Director of Research Support Center. We want to have a virtual research or academic conference, because we are thinking to say, what can we do that is applicable and responsive to Malawi? So we will be asking people from outside, but at the moment, they have just started the planning, where we want that within the next 3 weeks or 4, we should have a virtual conference to discuss what is applicable to Malawi, lessons that we can learn from outside, and what we need to provide for policy and also for practice as regards to Malawi. And maybe lastly, we had also worked with other universities in the UK to try to set up the impact of COVID in terms of maternal health, because we are saying the services can be affected because maybe the attention is on COVID itself. So we were trying to come up, we had a webinar on Monday where our head of obstetrics and gynecology was the speaker in that webinar to talk about what can we learn through the region in Southern Africa in terms of the impact of COVID on maternal health. Maybe I should stop there.
Thanks very much, Professor Mipando. Dr. Tracy Morse, I wonder if you'd like to come in with a little update, please.
I think there's very little that I can add that Prof Mipando has not already said. Very comprehensive. I think just to maybe he did mention the Polytechnic. The design studio is still working hard on making face shields and supporting where they can. I think, as we discussed last time, the focus being now on oxygen generation as opposed to low-cost ventilators. And as Prof Mipando said, it's fantastic to see the oxygen plant coming into the hospital, which is a great level of support. Also at the Poly, we're working with Blantyre District Health Office on some work to look at COVID preparedness. But as Prof Mipando touched upon, we're also trying to ensure that we measure what kind of impact COVID response is having on routine health services within Blantyre, which will hopefully be useful for other districts as well. And lastly, we're still working with the Health Education Service Unit on the development of tools for how to communicate with communities about the different preventive measures that they can be implementing in rural and urban areas for COVID as well. I think that's about all I have to add. As I said, Prof Mipando said it all.
Thank you, Tracy, most helpful. Prof Mipando, I wonder if we might take a question from Chisomo Banda, who says, I think it's great that all these universities have taken an initiative to create and develop protective gear such as face shields and so on. However, is this equipment accessible to the general public, especially those in rural areas? And is the equipment being made affordable?
At the moment, I think I would lie to say that the face shields and maybe the mask are available, but I have seen that the cloth type of mask, that when you go and drive in the rural, some of the people are starting to use that. But it would be a lie looking at the prices that would work. I know a number of NGOs are making donations of soap and others to use. But I think the messaging and the public health prevention will be more important, because I've seen already, I visited my parents who are supposed to be knowledgeable, but the way they were using the disposable masks, I was left to fear for them that I had to buy the cloth type so that they can wash, because the messaging on the using of the type of a mask, the disposable one might not be important, might not be well done, and that can end up being a problematic in terms of having false sense of security on things that are not being used properly. There's still a lot of messaging that needs to be done on how to wear even the mask itself, because it provides, if it's worn wrongly, it can provide a sense of security whilst you are not there. Going into town, you see even like in the banks, where the actual banks themselves, they are practicing social distancing, where they are allowing a few number of people to go into their banking halls. But outside, you see that people are just online, and that's where maybe the messaging becomes very, very important. So it's not only the rural, it's even in the urban setup. But in terms of equipment, to come back to the question, the kind that we are producing at the moment is not easily available. And I think we'll need to think through how we can use NGOs and others.
Thank you very much. Apologies to everybody that we're running approximately 20 minutes late, but I hope you agree that it was very well worth taking the time to hear from the Chief of the Health Services and Prof Mipando and others, and to be able to have the opportunity, the time for these questions to be asked. Professor Mipando is going to be with us throughout the rest of this call, and hopefully be some opportunity to surface some more of the questions that have been raised in the chat section. I'd like to suggest that public messaging and dissemination, whilst incredibly important, clearly vital, as has been mentioned in previous calls and strongly in this one, is essential. That it's been quite well covered during the course of this meeting today, and I propose that we move on to faith links. And I wonder, Eve Hartswood, I wonder if you would kindly give us a brief update on the activity there, please.
Thank you very much. There have been several contacts made through the SMP network between Christian NGOs and missions and the churches in Scotland who are working in Malawi. And this is allowing us to jointly build a picture of some of the challenges and changes that faith groups are dealing with. And all of these organisations are promoting the health messages from the government in Malawi, and importantly, demonstrating those messages in their congregations or hospitals or when they're working in the community. And I'd like to thank everyone who shared information and perspectives. This has been circulated in a short report. Most of the church services are still taking place, but with restrictions in numbers, and religious congregations and NGOs are the organisations which rural Malawi have the most immediate contact. So it's important to encourage these connections to spread uplifting messages of support, of faith and health information. The Church of Scotland is looking at a potential programme with Blantyre Synod Radio to share the stories of lockdown from Scotland, and the messages of our lockdown experience here might well help reinforce the information that's being sent within Malawi. For COVID-19, the churches can inspire cooperative action. So it's a community-wide response that's going out from the churches so everybody can understand and then implement the same protective strategies. There are some excellent prayer resources online from SNP members on their own websites that focus on the current situation in Malawi, and I'd encourage people to look at those if you're interested. And the Zambezi Mission have a call for prayer on the SNP website. So looking forward, we want to set up a Slack channel within the SNP. It'll give an opportunity for further conversation. And anyone who wants to join with that, please use the email on the slide, which I hope you can see displayed, which is faithpartnerships@gmail.com. And anyone who wants to join that conversation is most very welcome. Thank you.
Thank you, Eve. Thanks very much for that. We'll make sure that we share the address of that with everybody. I'd like to now invite Reverend Connex Ijalasi of Malawi Ministries, who is the Malawian partner of the Caruso Trust. Dr. Jonathan Groves, Director of the Caruso Trust, has been in touch with us. Reverend Connex Ijalasi, I wonder if you'd kindly give us a brief update on your work relating to COVID-19, please. I wonder if your microphone is unmuted, Reverend. So instead, Jonathan, I wonder if you're able to hear me okay and you'd be able to come in.
Yes, good afternoon, everyone. Yeah, I think Connex has his microphone still muted. We have been working with J-Life. We've had a fundraiser which has raised well over £5,000. And last week, the J-Life team went out across the Blantyre West rural area, held meetings working with the chiefs in particular, with whom they have an ongoing good relationship. They were giving the chiefs just basic instruction in the nature of COVID, how the disease is transmitted, precautions that can be taken, and then for the group village headmen, we provided the hands-free hand washing setups that they could then supervise and use within their communities. We also took one of the senior nurse from the rural health centre out with us, and he was again talking from a medical perspective about it. I think the key thing here is working with the chiefs and also with some of the more senior pastors who have influence within the community to get that message out across the rural area to larger numbers of people. So we completed our phase 1, and we've actually got the resources to do a phase 2 and 3 out to some of the other areas in Malawi where we have in the past been training church leaders and again have relationships. And those relationships of trust, people have been emphasizing they don't know who to trust at the moment. So the fact that we're working in an ongoing long-term relationship here means they're turning to somebody who they think they can trust to get this information. And I don't know if there's ways we can, you know, encourage partners who have trust relationships out in rural areas to be able to expand and get good practice messages out, and indeed assistance with materials.
And just to add on what Jonathan has said, through these training programs, we've been able to reach out to 222 chiefs and community leaders. And through the training that we provided, people have appreciated very much, and they are promising that they'll be able to change their behavior because of the information that they have received through this training program. And on top of giving them theoretical, presenting theory of the training, we were also able to teach them or to help them to organize, to teach them how to observe social distance. And at the same time, we were also encouraging them to make sure that they are washing their hands. And we did provide a box of soap to each and every church and the chiefs who were participating in the training program. And at the same time, we were also able to provide some other things like soap and the other important things. And in addition to that, we are preparing this Friday to go to Chimembe Health Center, which has been our partner, so that we can also be able to provide some of the hand sanitizers, gloves, and face masks, so that they can be able to use them as the medical people in the community where we are serving. And I would like to register my appreciation to the Keruso Trust for the support that they have been rendering to us, because we have been able to reach out to our community, to our communities through this training program. And I believe through this training which we organized, we'll be able to make a difference in these communities.
Thank you very much, Reverend Ijalasi and Dr. Jonathan Groves. We've heard consistently in these calls the importance of faith groups and their ability to have trust, which has been a key issue that continues to surface, and as well as providing spiritual guidance, very practical COVID-19 response, as you've illustrated there. Turning to the topic of COVID-19 and the impact on people with disabilities. Action Amos, I wonder if you'd like to come in, please.
I didn't put my video on.
Action, I wonder if your mic is muted. This is something that I keep forgetting to do myself. Are you still there?
Yes, he's muted as well.
Thank you, Stuart, for the opportunity. So as I've been entitled persons with epilepsy, whom we have, based on the 2018 census, we have about 400,000 plus. Currently, we have a project that's currently running in Blantyre, where we are monitoring issues to do with COVID for persons with epilepsy. We are working with Oxford University, and we have a real-time monitoring program that we have in the district. What we have noted so far, there is no availability of information. Messaging is not getting across to persons with epilepsy, including those with disabilities, due to different challenges. Other challenges such as inclusivity of the messages. We see no sign language. We see no braille being used among different types of disabilities. We also have another special grouping with these persons with psychosocial disabilities. Again, they still face a challenges. Those in institutions, it's still a challenge. No messaging is getting across to them. Those in the streets, again, there isn't any provisions that have been put across. And among persons with epilepsy, there is a reluctance to visit health centers because of the stigmatization that is there around COVID. As has already been mentioned by Vera, that you know, some of the issues we're talking about here have been in existence already. For example, the non-availability of medication for persons with psychosocial disabilities or persons with epilepsy has been an issue. Now, this has been now coupled by the issue to do with social distancing. For example, in a district, one district where we are working in Machinga, people are not getting medication because there are no mobile clinics that are coming in the health centers that are in the rural areas. So they organize themselves, put their health books together and send one person to go and collect the medication at a district hospital. Now, they used to do that because transport then was cheaper, but because of social distancing in our public transport, where they are limiting the numbers in the public transport, the transport fares have actually doubled, if not tripled. This again has made persons with epilepsy not accessing medication as they needed. This now has led to a huge impact in terms of adherence. So we are starting to see recurrence of seizures among persons with epilepsy, non-adherence to their routine taking of medication, which is quite a challenge. So we really looking at other ways on how this can be addressed. But with our engagements with the two districts I've mentioned in Machinga and Blantyre, we're still facing a challenge, especially around issues to accessing health services. One, even among the health support personnel, there is still some gaps in terms of awareness among themselves, worse among persons with epilepsy. And as you know, with people with disabilities, some are on wheelchairs and so forth. So it creates a lot of barriers for them, even for social distancing. It's still a challenge. Though currently we're still looking for some partnerships and also learning best practices from other countries to see how well have they handled persons with disabilities. And we're also putting a research proposal that maybe will go through College of Medicine with Edinburgh University, the School of for Health and Social Science, which will be focusing on persons with psychosocial disabilities in refugee settings or humanitarian settings. So for now, because of time, I'll stop there. Thank you.
Thank you very much. You make a very clear and powerful addition to the impact of COVID-19 on people with epilepsy. Gemma Conley-Smith. Gemma, I don't know if you're hearing me okay.
Can you hear me?
Yes, thank you.
Hello, everybody. I am the current Media and Comms Officer for the Scotland-Malawi Partnership, and I'm going to be speaking on behalf, just a quick message, which I'm just trying to bring up, from Olivia Giles of the charity 500 Miles, and she's an SNP member. They are SNP members, and she couldn't join us today, but she's sharing the following points. So this is 500 miles. From our standpoint, we're determined to stay open for people with disabilities who need to come to us for our services. But since we can't do outreach and travel has been restricted, we know that approximately 2/3 of people who would have been served have not been. But it obviously isn't just about the difficulties of accessing disability and social services. Absolutely everything that has been made more difficult for the average person as a result of the virus and restrictions will be compounded for people with disabilities. I think there is a real problem with messaging around hand washing and social distancing, even reaching those people with disabilities due to the difficulties with communication. So that was Olivia's message, and we at the SNP are very keen to draw everyone's attention to our COVID hub section pieces. We've got several there now, and the latest piece, which went up today, is a Malawian team member, Samuel Mkomera. He works in the orthopedic and prosthetics team in the prosthetic and orthotics centre at Kamuzu Central Hospital. And he has written a really moving piece about the day-to-day realities that they're experiencing there. So I would encourage you to go and read that. And if anybody listening here would like to contribute a piece themselves, either written or video, as you can see, some of us prefer speaking to video or prefer writing, and I'm an advocate of written things myself. But yeah, if you would like to contribute something, about 2-minute video of 400 words of your lived experience of COVID-19, where you are, please get in touch with me. I will share my email address shortly in the general chat section. If I can't manage to do that in the park where I am at the moment, I will make sure that everybody's got it by the end of this meeting. So, and if you've got any further questions about the prosthetic and orthotics work, or about 500 miles generally, please do contact Olivia and 500 miles, and we'll make sure that those details are available to you as well. Thank you very much.
Super, thanks Gemma, that's great. I'd like to pass over now to David and to make introductions on safeguarding.
Absolutely, thanks very much, Stuart. Keen to flag up the excellent work my colleague, the Youth and Schools Manager, Gemma Burnside, is continuing to do in leading our work with youth and schools in the COVID space. So particularly, how do we engage those Scottish schools, obviously currently closed because of COVID. If you're interested in the SNP's work in that space, but you're not currently involved, please do email Gemma. Details, I'm sure, in the chat box, and we will distribute afterwards. Also, as I'll say more about a little bit later on, we have now created the Slack group, which is the main communication platform we will use for everything on a day-to-day basis between these 3 weekly Zoom meetings. And there's a specific youth channel, #youth, that we'll be using for dialogue around youth and schools. But we particularly wanted to flag in this meeting safeguarding. As we were talking with members about the principles of good practice, safeguarding was something that came up very loudly and clearly from both Scotland and Malawi. So it's there in the principles of good practice, as we'll see later on in this meeting. And I just wanted to turn to two friends and colleagues to say a little bit about safeguarding in the context of COVID. First, I'll turn to Vera in a moment to say a little bit about what MaSP is doing, our sister network in Malawi, and specifically the safeguarding courses they have coming up. And then to Philippa Ramsden, who's leading much of what's happening in the sector in Scotland, for her reflections about safeguarding in the time of COVID. Vera, if you're there, grateful if you're able to say a few words from the MaSP's perspective on safeguarding.
Thank you very much, David. I think our port of departure was the fact that a lot of people now are spending a lot of time at home, and then there's been several issues coming to us in terms of what is the impact of that in terms of gender-based violence or violence against children and all that. But also because of the COVID-19, a lot of people are vulnerable in the communities. What will NGO workers, for example, won't they be taking advantage of the beneficiaries to demand sex, for example, or something like that, in terms of getting a lot of extra help from the NGOs that work with them? So our work was already in the pipeline in terms of training our members on safeguarding issues and all that, but we have had to accelerate that work for us to ensure that we start with the southern region to conduct training of trainers for safeguarding issues. The key issue, the two main objectives is for people to understand issues of safeguarding, because both as an institution for their own employees and also as they relate to the work that they do in the communities. So those two aspects, so that we could flag out those kind of safeguarding issues, just to ensure that everybody is aware, and that as people are doing their everyday work within their offices and in their communities, they understand and safeguard issues and safeguard people and ensure that we are not doing any harm to anyone. The other thing is that at the end of that training session, we endeavor to ensure that people have the skills required for them to develop their own safeguarding policies for that will address issues for their offices, but also for the work that they do. Now, as MaSP, we have come up with a safeguarding package for us as an institution, but this is something that it can be found on our website at the moment, and we have translated the same to Chichewa as well as to Mbuka. One, in our quest to ensure that we are leaving no one behind, so people should have access to that policy and read it and understand it. So that if they want to understand it in Chichewa, they should have access to that one, and also in Tumbuka for our Northern Region colleagues and members there as well. So what we are saying is that we are not encouraging members to just copy and paste, but if they want to copy and paste, they could do that as long as it's relevant. But what we are saying is they could use this policy that we have developed as a framework to develop their own policies as well in the safeguarding space. So the training that we have planned for now is going to run from 15th to 18th of June. The first 2 days we are going to take on senior members of staff, and then the next 2 days is going to be junior members of staff. What we had seen, because we had consulted members before we did this schedule, we discovered that some junior members of staff will not be free to discuss some of the safeguarding issues within their workplaces when their bosses are there. So it would be good for us to separate them in that regard. So maybe at some point when we have the time and resources, we may combine the senior members of staff and the junior members of staff. So for those members, I think it's on our Facebook page and also on our website, but they could send me an email. I'm going to give Stuart at the info at Malawi Scotland Partnership.org for those members in the southern region that would like to be part and parcel of this training. So David, I think in a nutshell, that's what I can say. Thank you.
Thanks very much, Vera. That was excellent. So again, to reiterate, details about those courses could be found on the Malawi Scotland Partnership website, on their Facebook page, and we'll continue to disseminate them in our own bulletin, weekly bulletin at this side. I wonder if I could turn to Philippa Ramsden, who's at the Scotland's International Development Alliance and is very much a leader of safeguarding work in the sector, and has been out to Malawi and worked very closely with both the SNP and MaSP for her brief reflections on safeguarding in the time of COVID. Philippa.
Thank you, David, and thank you very much to all of you at Malawi Scotland Partnership and Scotland-Malawi Partnership for including us in this conversation. Yes, in a nutshell, I hope I can put this into succinct words as Vera has, but I think we've recognised that safeguarding has been very high priority. It's had a lot of attention, and then understandably as the COVID pandemic has swept across the globe, suddenly this has impacted on everything. It's impacted on our work, our personal lives, our home situations. And with regard to safeguarding, it's impacted particularly in two ways. Firstly, our work on safeguarding, the plans we've had and the priority that it's had, that's had to suddenly been kind of put to the side and reconsidered. Many of our planned activities and activities have had to be postponed, they're delayed, they may even be cancelled. And secondly, the thing I'd like to focus on is the fact that the pandemic itself brings new and different safeguarding risks. So very briefly, just to kind of comment on that. Our own plans at the Alliance, we have had to convert a lot of our work to online modalities, and some of it is more fitting than others. For example, our trustee training has been a full day training that we've been holding throughout the year at 6 weekly intervals. We've now amended that and are holding information webinars rather than proper trainings as an interim measure, and the first of those will take place on the 18th of June, and it's open to trustees involved in international development work. Those who are based in Scotland, it's looking from the regulatory perspective. Secondly, we have been working very hard on developing access specifically on safeguarding in COVID times, and these are logged on our Alliance website, both under the COVID pages, which are dedicated pages on COVID resources, but also under the safeguarding pages that are there. As in terms of what the pandemic brings, and it brings new and different risks, we know that in times of crisis and emergency, and we've already heard very powerful highlights of particularly people with disabilities and other groups that are especially vulnerable, people are disproportionately affected adversely in times of crisis, and are especially at risk of abuse, exploitation, harm, neglect during the pandemic, particularly with forced isolation, with lockdown scenarios, with school closures and restrictions on work and movement. And Vera has already spoken a bit about some of those risks that there are in place. So what we need to do is have this kind of dual approach. Firstly, that we continue to prioritise as far as we can our safeguarding work and our safeguarding activities. And I think it's really inspiring to see that your trainings are taking place in mid-June. I'm so happy to hear that. But also we need to really reach out and listen and share our concerns, share our observations, and look at how that impacts on the safeguarding work that we're doing. And in regard to that, I'd like to highlight that we're holding our next meeting of the Safeguarding Working Group, which is really a working group made up of Alliance members, but with those who have also got a particular interest. And it's been marvellous to have had Vera's engagement in that in both of the past meetings. And it was on my to-do list to reach out to Vera and ask if she would be able to join us for the next meeting on the 30th of June. Now that meeting is going to look at two particular areas. Firstly, it'll be looking at presenting and that's another piece of news I've got, the Resource and Support Hub, which we've known has been coming for a long time. That was launched a couple of days ago. It's got specific COVID pages on it, and we'll be hearing from them exactly how we can engage there. But the second area that we'll be looking at, the second agenda item, if you like, is listening and learning about COVID and how it's impacting on our safeguarding work. And that, as I say, really will be, I would like it to be initially a listening exercise so that we can really understand what the implications are, what is happening. There will be new and different, there are new and different risks that this very unusual situation is bringing to us. And we want to truly understand what that will involve and what it might involve and how we can respond to that. So that is a very brief overview of our kind of reflections and what we're doing in terms of taking things forward. But also I think it takes us almost around in a full circle to my own visit, which you talked about, David, in the introductory remarks, where I did meet with a number of people. I was able to really listen and understand about the context in Malawi, and it was wonderful to work closely with Vera and the team to be able to look at how the safeguarding agenda could be moved forward, and to see how phenomenally that has moved forward in Malawi has been really heartwarming. And so coming round to that full circle, I'm delighted that we are able to continue working together on this, because this is, like the pandemic, this is something we are all in together. And by holding hands and moving forward, we will be able to strengthen how we work on it. So thank you very much for including us today for this discussion. It's been really helpful.
Thank you very much, Philippa. Stuart, back to you.
Thank you, David. Thank you, Vera. And thank you, Philippa. We are running around half an hour late, but I'm really keen to surface questions and comments when they come up, and everybody will have the chance to listen back online to any parts of it that they want to also. So very briefly, a comment in the chat to everybody from Thomas Nkanjera, who I think, sorry, you're from the Livingstonia Synod, if I remember correctly. I wonder if you'd like to articulate your point to Prof Mipando around committees and action needed.
Hi everyone.
Hi.
Are you able to hear me?
Yes, thank you. Please go ahead.
Yeah, thank you. I'm trying to look to evaluate everything that has been said, and I'm also trying to look at the current situation in Malawi. And my observation is that we have the committees that are fighting the COVID-19 from the government level. But to me, since I'm in the field and I'm in touch with the communities, it is very much clear to me that people have lost trust in the people that the government has entrusted them to handle the issue. Now I have of the view that why don't we, under the leadership of MaSP here in Malawi, to come up with a task force team so that we support the Ministry of Health. They have good ideas, they have good strategies that have been put in place, but I think it's a matter of trust now. Why don't we come in and we can entrust Vera and the team to lead us through?
Thank you. That's clearly put. Principal Mipando, would you like to come back with any comment on that at all?
Interesting suggestion. I think it doesn't hurt to form. From the college's side, we might not say it here. That's why the purpose of having even our dean, I think you are aware initially it was just a cabinet committee, and indeed it had issues in terms of trust with what had happened and also maybe the presentation itself. With the new committee that has been set up, those that are in Malawi will agree with me. They have really started coming out since last week. And I think since last week, the announcements are being made by my dean, who is the co-chair from there. The challenge with having multiple is also you need to be speaking the same language. So supporting, yes, the ministry, but you wouldn't want, but personally, I don't think you would want to have so many mouthpieces. What we are hoping is that the new task force with the new chair, the dean from the School of Public Health, people with time, he will gain the trust because of how he's presenting. As you have already seen in the presentation, he's now starting to use graphs to show what is working in there. And I can tell you that like the second group of returnees that came over the weekend, it was him who championed the talking to them, the 268 that came from Mwanza. He went to speak to them to make a plea, and they were able to listen to go to the isolation centers, unlike the first group that came. So what we are hoping from the college is that now that this co-chair has started giving a face to everything that they're saying, with the support behind him from the universities and others in terms of packaging the information, people will trust. And if you have listened to him even on the radio, you will see that he even says things against the politicians where he would actually say, I'm not happy with what the politicians are doing. So from the college side, if for us would want to support more the person we have sent to be in the chair of the committee, but parallel structures at particular levels, but working with the ministry, because at the districts, we have the district health and social service officer who is in charge for every district. So if they can work with those, maybe that would be important. But it will be, I don't think it would be good to have multiple sending messages that are different. That also might work to the disadvantage of what we are trying to achieve.
Thanks both very much. The Chief Exec, Vera, and the Chair of MaSP are both on this call, Thomas, so a chance for them to hear your point as well and suggestion around MaSP. Dr. Anpoya, Chair of MaSP, I wonder if we might briefly turn to you, please, for your comments from your work at the forefront of things. Dr. Poy, I don't know if you're with us or muted perhaps.
I'm trying to unmute.
Thank you. Great.
Okay, can you hear me now?
Yes, please go ahead. Thanks.
Okay, yes, I wanted basically to comment on what has been said regarding MaSP coming up with another team of committees. I think I would support the College of Medicine's point of view that we don't really need the parallel structures. What we need to do is to try and fit in the systems that are already, or the structures that are already in the ground, so that we can put in our voices, so that where we think things are going wrong, we can probably put in our voices. These committees that have been formed by Ministry of Health, they are open to anybody, and you can join in, because these meetings take place not only physically but virtually. And I would encourage our colleague Konjera to try and talk to the district committee where he's residing, so that he can join any of those committees. But to us operating at the Lilongwe level, we can join the government committees. For example, on my side, I sit on so many committees, and where I see that things are not going on well, we make the necessary interventions. So I would really not adopt the idea of having parallel structures or multiple structures, because already we are having so many meetings and there's little time now to do the actual work on the ground. But we can try to be integrated in the ongoing committees. Over.
Dr. Poya, thanks very much for that. David, I wonder if we might now turn to you for principles of good practice, please.
Grant, thank you very much. Stuart, just while I'm doing this, I'll see if I can do a quick screen share. Hopefully that's working. Can I check, Stuart, can you see my screen?
Yes, thanks.
Super. So, hi everyone, keen to say a few brief words about principles of good practice. I know we're a bit behind in the agenda, and I think we can make up a bit of time in this section, but I do think it's important to brief, to update this group and seek any further input you wish to make. Very early on, the SNP with MaSP decided that it would be helpful for us to discuss, agree, and then disseminate what we saw as the principles of good practice in responding to COVID-19, principles that are relevant in both Scotland and Malawi, and principles both for implementing organisations, whether they be NGOs or church links or school links, but also for funders as well, Scottish-based funders funding work in Malawi. So we invited through a series of meetings and digital consultations, members and key stakeholders to suggest principles. We've discussed them, as many will know, in these previous series of meetings. And we've agreed 8 principles for operational organizations and 8 principles for funders. I won't go through in any detail, but very briefly, those 8 principles for operational organizations you can see in front of you there and are on our webpage. You'll find the COVID-19 hub and a child page down from that specific to the principles that we're looking at here. So do no harm, two-way sharing between Scotland and Malawi, but also respecting and recognizing the differences between Scotland and Malawi, understanding the local context, collaboration and coordination, continuity of and commitment to existing work, especially where there's trust and understanding, a point that we heard come out very powerfully from the Faith Links side of things. Prioritizing safeguarding and human rights, as has been discussed, supporting the local economy, and crucially dialogue with supporters. And that leads on to the 8 principles that we've agreed as a group for funders. They are firstly looking for additional funds and practical support, not looking to rob Peter to pay Paul. Secondly, really encouraging open, respectful, two-way dialogue with those organizations that are funded. Encouraging funders to work through existing grant holders, again, recognizing the value of long-standing relationships and networks of mutual trust and mutual respect, rather than just stopping work over here to start a new COVID project over there. Number 4, do no harm by maintaining normality as much as possible. There is a healthcare crisis in the making, but it's important in responding to that we're not stopping work in education, in the economy, in energy. 5th, maintaining a flexible and understanding approach, recognizing in Malawi, just as in Scotland, the situation will continue to change. Sixth, pausing rather than cancelling funding. Seventh, recognising the impact on the wider sector, that many charities are losing a lot of their unrestricted funding because they can't fundraise as normal, and working with the SNP and other key networks. Just a very quick update to that. We've now got this webpage, and over the next week or two, we're going to be really promoting these principles. So firstly, for those principles for operational organisations, and there are a great many on this call today, I really encourage you to look at those 8 and think, is this something that you can sign up to? There's not going to be a very formal or restrictive process to sign up to these principles, but we encourage you perhaps on social media to tweet the Scotland-Malawi Partnership at Scotland-Malawi, linking to this page to say, you know, you're supportive of these principles, you endorse these principles, and you're looking to work within and towards them. And I think the more people that we can have sharing that message, the more effective these principles will be, the more useful they will be, and the more widespread they will become. And then with regards funders, we've already had some really good discussion with UK-based funders funding work in Malawi, a really good detailed conversation with DFID Malawi earlier this week. And I've got to say, a lot of the feedback that we've had from members who are DFID funded is that DFID is really leading the charge in working within these principles. We've heard from the last SU meeting that some of our members funded by DFID were contacted by DFID and really asked, you know, what do you think should happen locally? How do you think you should pivot your work, reallocate your resources to respond to the local situation? And what was proposed by NGOs was in many cases signed off by DFID within 24 hours. So I think a strong alignment from DFID Malawi to these principles, and we hope to get some degree of endorsement from DFID to those principles. Similarly, we're speaking to other Scottish-based funders as well, and we hope with the Scottish Government as well to really encourage these principles. Time is limited now, but if there were any brief comments or input, what else we should be doing, how we should be promoting or disseminating these principles, please do jump in now. Stuart, I don't know if you want to chair that, maybe just sort of 1 or 2 questions or comments, if there are any, on the principles.
Sure, thanks very much for that, David. Would anybody like to come in with any questions or observations on that? Michael Beresford, would you like to come in, Mike?
If I have to. I was just really talking about the second point, the two-way sharing. I'll put my video on as well. The two-way sharing. I was thinking about how we think of our partnership with our Malawian partners as an interdependent thing. You know, there's a mutual relationship, and sometimes we think of just helping the people in Malawi, but actually, certainly in a spiritual dimension, we receive such a lot from our partnership, from learning from the way that they worship God. So I don't quite know how we get that through in terms of the partnership. It's not just about two-way communication, but it's we give, but we also receive. We bring what we have to the table and we share it. That's really what I was trying to wonder, how could we bring that out a little bit more strongly?
Good, thank you very much, Mike. Responding briefly, if I may, to that. I mean, in some ways, you've described what is the most important, the most core ethos of what the Scotland-Malawi partnership is. And that's very much entrenched within our 11 partnership principles that have underpinned all of our work for the last eight years or so. And a point that we are really keen to emphasize as we talked about principles of good practice in the COVID space is that these aren't instead of those partnership principles of mutuality, of reciprocity, of sustainability, of two-way benefit, but very much the sort of the COVID specific ones. So it's a very good point that you make, Mike. Absolutely music to my ears, and we'll continue to link to and champion all 11 of those partnership principles, especially that spirit of mutuality that you articulate there.
Thank you. Anybody else like to come in?
Yes, please. Could I? Tim Eden.
Hi, Tim.
Hello, hi. I'm just slightly worried on both of the lists, particularly for operational organisations. We started our charity 13 years ago. We now have 8 partnerships around the world, all in low to middle income countries. And in each one of them, we've had to fall right back. We are getting some money, of course, from DFID and so on, but actually we were bringing in twice or 3 times the amount of money that we were just at the end of last year. And I think you will have a great difficulty for looking for additional funding for not only our charity, but many of the small charities who come together and across Scotland and the rest of the UK. And I think many of our people will also have to go. They will not be able to pay for the people who actually were going to help with the education. And I think we need to think about that and put a lot of pressure on people to give us money. But with the economy for the next 2 years at least going to be a real problem to deal with this amount of money for charities. Already the big charities like Oxfam and whatever are actually throwing people out. And small charities will probably do the same as well, I'm afraid. So I think we need to think about that, particularly number 5 in the organisation.
Absolutely. Professor Eden, some excellent points there, and something we're very much aware of, those financial difficulties, and I think we'll come on to that in a moment in this meeting. Very keen to emphasize, that's why for the funders we were very keen to have that point 7 about recognizing the extreme economic financial pressures that charities, whether large or small, are under. That's why we're very keen in the principles for operational organizations to encourage our members to be honest with their partners in Malawi where there are real economic and financial challenges and hard decisions to be made. I suppose the one there about seeking additional funding, and perhaps I think you're right, the wording could be improved there, is about ensuring that we're encouraging our members not to be stopping what they're doing if they possibly can, but looking to respond to COVID in an additional way where resources allow. But the point you make is a very valid one, and we'll see if we can polish up some of that language. Thank you, Tim. Stuart, back to you.
David, thanks very much. In fact, it segues very helpfully into the next 2 parts of our agenda, which I'd like to suggest in the interests of time we amalgamate. So these are around resilience, adaptation and pivoting work, but also, as Professor Eden speaks of, finance and fundraising. And we've heard in a previous MaSP COVID-19 call about some of the inspiring adaptive work that our friends in Malawi are trying to respond to the situation that everybody finds themselves in, but with great impact, understandably, on what people are able to do out in communities and in delivering campaigns. The point of these meetings, really, again, member-led and member-driven, is to share challenges, but also offers of help. I wonder if anybody would like to come in with any points about strategies that they are developing or working on in terms of resilience and adaptation to the situation that we find ourselves in. It's really quite a broad and challenging question, isn't it? And I wonder if perhaps surfacing anxieties and understandable concerns about future finance and fundraising. So again, on a previous MaSP call, we've heard that many organizations or some organizations fear that they won't last until Christmas without really quite drastic levels of support coming in. I'd really like to share either any concerns or any potential solutions around financial stability going forward.
Stuart, could I speak?
Please, yes, please, Professor Heather Cube.
It's very interesting taking a leaf out of this book of these meetings, which have been so wide-ranging. We were able last week to have a Zoom meeting, not just with our Malawian coordinator, but with a distributed number of the participants in our project, of the focal people in every centre. And that's the first time we've done that, replacing what would have been a partners meeting in April. And it was actually very helpful to hear about the resilience in all the local centres and what they're doing differently, in some compared with others within our project, which is a health related preventative health and cervical screening project. But somehow or other, it gave us so much more hope that actually, this is very different from the kind of things that Professor Eden's saying about finance, but actually just feeling that we were able to share and understand better by speaking to more voices of those who were involved in similar activity than we've ever managed to do before. So it's actually taking this kind of approach and just expanding it and finding it still works. Thank you.
Thank you, Heather. Anybody else like to come in?
Could I just come in? Susan Flynn.
Please, Susan.
It's just I haven't got a solution for this, but it does concern me greatly that all the funding that I have been able to find has been for charities helping in the UK. And there's no real support for small international charities, for example, to be able to survive the current situation of not being able to fundraise in the normal way. We do have one positive experience happening tomorrow. It hasn't been organised by us, but it's been organised by an eco, well, it's called an eco fashion event that was due to take place in real life earlier in the year, but is now going to be virtual tomorrow. And we're going to see how this works. I'm going to be given 10 minutes to talk about our charity and to show an example of our work. And there'll be a website link so that people can go onto our shop on the website to be able to buy products made in Malawi. So that is one kind of solution. And we're addressing our fundraising issues within Shifundo by doing a risk assessment, which we probably should have done some time ago. And each trustee has been asked to come up with one new way of fundraising so that we can survive.
Can I say something as well?
Yes, thank you, Susan. Yes, please go ahead.
Yeah, I also wanted to chip in that indeed the issue of the financial resources is an issue, and we need to take care of the little resources that we have. And what I have noticed is from what David presented in terms of the principles, I would like to to reinforce the issue of flexibility and adaptability, so that those of us that have given money to other institutions, probably we should allow them to reprogram the money if possible, so that they can support the activities of COVID in their own work experience. But at local level, I have seen a lot of generosity from individuals, companies and whatnot, giving money towards the response. So the only thing that we can do probably as MaSP is to make sure that some of the principles of good practice that have been mentioned, probably we can advocate for them, so that those people that have donated their items either in kind or in money, that these items are indeed put to better use. For example, I've been to some health centers where I noticed that even some health workers, midwives were working without PPEs, and yet we know PPEs are being donated in the country. So those are some of the things that we can do to play the role of either I don't want to use the word policeman, to guard that things are used the way they're intended, to promote transparency, to promote accountability with the few resources that we have. I think that's what I wanted to contribute.
Thank you, Dr. Anpoya. Great. Heather Palmer, I wonder, you put up a point in chat. Would you like to come on the line with that?
Hello, can you hear me?
Yes, thank you.
Thank you for inviting. I'm just saying that, like a lot of organisations now, we're looking at going online, but that's already been said. We're obviously postponing events to next year, but we've no idea what next year will be in the UK. So many of our events are held in the summer, and that can't be happening this summer, obviously. Unfortunately, we've had to cut back on staff and project activities just by tightening up the belts.
Thank you, Heather. Yes, really very impactful. Sorry, did somebody else want to come in there? Who was that? If not, Daisy, I wonder, Daisy Belfield Santos from the Rare charity, I wonder if you'd like to come in.
Sorry, yes, just grappling with technology. I mean, it's a pretty kind of non-substantive and obvious one, but it's yielded great results for us, which is to just ask individual donors who've given in the past to see whether they'd consider giving more regularly. And this has, it's actually yielded very surprising and fruitful results for the charity.
Great. Well, certainly all solutions definitely welcome by everybody, I'm sure. Well, I'd propose that we move now on to operational updates. I wonder, Mike Beresford, if you'd kindly start us off.
Sorry. Yeah, I mean, I've got a little bit of a hangover from the sort of fundraising. I mean, we visit churches, and we really rely on visits to churches in the UK to sort of maintain giving, and we obviously haven't been able to do that since March, so we're kind of not quite sure what the long-term impact, but so far we haven't seen a drastic drop-off in giving, just a low level of giving, so we don't think there's going to be any serious impact. But our main sort of area of work has been providing PPE for our health centres, our partners' health centres rather, in 5 different rural areas. And we've been able to do that twice thanks to generous giving from our supporters. We also support a Bible college. We're co-owners of a Bible college in Blantyre. And at the moment that college is closed, and it had financial concerns before the COVID pandemic. Now we've really got to make some very serious decisions about staffing levels and courses. And of course, nobody really knows when the college will start again. The other sort of concern is about safeguarding. That's been touched on so far, but we're kind of thinking, how are we going to address the safeguarding gaps we have with the with it being pretty likely we're not going to be able to go to Malawi until 2021, we think. So how are we going to manage that? We should be able to use local partners to help with the training, but the actual visiting hands-on is quite important to us. So we're not quite sure how we're going to manage that, but in a sense, that's tomorrow's problem. Thank you.
Thank you, Mike. I was grappling with the technology buttons there as well. Ruthie, Markus, I wonder if you're still with us to give an update, please.
Sorry, Stuart, I'm still with you.
I don't know, do you want me to? I'll try sharing my video. There we go.
Right, great.
Hi, good afternoon, everyone. Thank you, Stuart, and to SNP very much for giving Amica the opportunity to give you a brief update. As you're aware, and I can maybe, if your media people want it, send a report on this to you, but there were several points raised during the last sort of hour and a half or so that were pertinent. We also did not suspend our activities in terms of what we're doing. We're in the closing stages of the completion of a maternity unit for the Blantyre District Health Office and a huge community rollout program and staff uplift training to follow. So notwithstanding that initiative is happily going on, we decided in response to a plea for PPE, we managed to get some grant funding from Rotary and put in some funding of our own and made a donation of PPE to the Blantyre District Health Office on the 24th of April to include a large number of N95 masks, huge number of disposable aprons, and also 100 sort of full cover bodysuits. And we are lucky enough to have a long-standing relationship with the very excellent current DHO office and Dr. Kalawazira, the DHO for Blantyre, and under his guidance and under our own experience, because one of our directors is a consultant surgeon here in the UK, so we had a pretty good idea of what was needed. And so we were able to ensure that this was properly distributed with due diligence. So Amica's very happy to report, because we're so small, interestingly, we don't have staff to pay, and touch wood, we feel that funding is going on as normal. We've benefited from a lot of grant funding. So we hope that the situation won't exist. At the moment, I'm marooned in the UK, but we are trying to get back to Malawi in the autumn of this year. And so that's an update for you, Stuart, on what we've been doing for COVID, coexisting alongside our main objective of taking this huge training program out into the community. And I concur with what people said, that it's very reliant on a really good relationship with the chiefs. So we're lucky enough to have a hospital advisory committee at the primary healthcare clinic we built for the Blantyre DHO. And therefore, we've got representation of that. So the messaging on safe practicing is hopefully being taken out via the hospital advisory committee and HSAs doing field work. So not easy. It's been a really, really tough time. And the toughest time is I'm wondering what your other members are doing in terms of a return to Malawi, because that's one of the questions I wanted to ask, if people wanted to come back on that. Because it's dead hard to know when we can safely travel and when, you know, borders might be lifted and so on and so forth. So I hope that's been helpful.
Thank you, Ruthie, very much. And I think it's probably a case of watch this space in terms of when we're all going to be able to continue working and return to Malawi. We'll certainly post any of the intelligence that we receive from the FCO regarding that, and working with our trusted tourism advisors, Orbis Travel, Dom and Kate Webb, and share information that we receive on that. I wonder, would anybody like to share some information briefly, perhaps for just a minute, on appeals that they are running, either as a direct response to COVID-19, such as Ruthie's mentioned there, regarding PPE, or whether it's about that sustainability point about being able to fund our operations going forward.
Could I come in again, Stuart, from Shifundo.
Please do.
I'm trying to get the video to work. Okay. Just to say that people have been very generous with regard to the appeal, and although we're small, we've raised £6,000 so far, and there's more money coming in, and also an additional £3,000 from the Suter Trust for PPE. And I'm very interested to hear what Ruth had to say, because we've discovered now that fortunately the 30 clinics in Blantyre have been factored into a big supply of PPE that's coming in from, or it may have already arrived from China, that has been organised by the Wellcome Trust and Liverpool School of Tropical Medicine. And they've included the whole of the community services as well. So our focus is going to be on vulnerable patients who turn up at the clinics and who don't have masks, and also to cover places like Folombi and Malangi, to cover the staff there and patients who are vulnerable. So thank you.
Thank you, Susan.
Hi, Stuart. Could I come in? It's Mary Popple from JTS.
Please, Mary, yes.
Hi there. Just to say that we have, I've just been checking our site, we have raised around £6,000, and we have some other money coming as well, which we are splitting between the rice farmers, obviously, in Karonga in Malawi, and our other suppliers. And we have found people incredibly generous. We've put up our total giving page, and people have really responded to us. So there's definitely people out there who are perhaps not wanting to give money in this country for things here, but they recognize that there is a need elsewhere. So that money is going on masks, on mobile phones, on other PPE, and potentially also on school desks, because in that area of Malawi, everybody sits on the floor in school, and there are concerns about how they can, if they are going back to school, how they can social distance. So the suggestion has been to actually make school desks. So there's a program started in Karonga by the farmers themselves to make desks for their school. Thought that might be quite interesting to people.
Absolutely, Mary. Thank you. Would anybody else like to come in?
Make a comment?
Anne, please.
Yes, I wanted to make a comment. Yes, I wanted to check whether it would be possible for our colleagues that have managed to at least mobilize the PPs and sending them to Malawi, if we can get that information through the MaSP Secretariat, because it will help some of us that sit in the national committees to know which facility or which communities have received these PPs, because they need to assist the national level, not to duplicate efforts, so that at least there's some equitability in the way the PPs are being distributed, because it is possible one facility may get, 2 or 3 supports from, international partners like yourselves, and yet the government system also go to the same place and provide. So I don't know if that would be something that we can do.
Thank you, Dr. Parnell.
Could I come in again? Was that Anne who was speaking?
Yes, yes.
Mulibwan Jamai. Yeah, in response to Anne's very good comments there and questions, I think there's no single answer to this, but in our sort of humble experience of these things, it's a lot easier in terms of A, due diligence, B, accountability to the kind donor that might have given you the money, and so on and so forth. If one works, if possible, directly with a DHO or a few DHOs, because there at least you can give a targeted response, if that makes sense, and find out, where equipment's going, where it's being used, and so on and so forth, rather than it falling into a bottomless pit and we've always tried very hard at Amica. Accountability is a big thing with us. And I think it just makes it a lot easier if somehow one can engender a donations in direct response to something. So I don't know if that makes sense to you, but that would be my 2 pennyworth.
Yes, actually what I meant was, let's assume you have mobilized some PPs and you have sent them to Blantyre DHO to distribute to, let's say, health centers that you know. Let's say, for example, Zengwangwa, Bangwe, name what have you.
Yeah.
What would be what I was proposing, that if that information, not the actual consignment, but the information that you have made this donation to Blantyre district of so much, so this information goes to our secretariat, and I get hold of it because I sit in the supply chain of government. So I would know that, you know, the ministry was planning to go to Blantyre and give them, let's say, PPs. So I would be able to say, no, this time don't go to Blantyre, probably go to Mwanza, because these guys have received the consignment from Scotland. That's what I meant.
Okay, I follow you, Anne. Amica's email is in the email list that the SNP requested. So if you send me your email directly, I'll be happy to tell you. I mean, it was, you know, in terms of a huge Chinese donation, I mean, it's pretty modest. We're a small charity. And interestingly, we didn't send stuff from abroad because in our view, that would have been kind of wasting money in transport. We actually, the DHO, and people on the ground, we could source it directly in Blantyre, which made things a lot easier as well and saved costs.
Okay.
Clearly, you have one another's contacts and know each other, and great if you can deal direct. But also, we're very happy at the SNP to signpost and share resources as we've been doing on the COVID-19 section of our website, if that's useful to anybody. I wonder, finally, if there's anybody to whom we've promised to register the interest in sharing an update or speaking about an appeal would like to do so before we move briefly onto an open question session. So in that case, we'll turn to open Q&A. So really anything that anybody has been frustrated that hasn't been raised, that maybe they've put in the chat section that I've missed in actually verbalizing, but again, everything that's put there isn't lost. It's all included in the process. Would anybody like to come in with a question or a comment? If not, in the interests of time, David, will turn to you, please, with your thoughts on the 3 simple recommended actions.
Thanks very much, Stuart. One of the things that I guess we've heard from our members and discussed with some key stakeholders is whether there's a role for the Scotland-Malawi partnership in the next stage to offer more succinct, more simple, more easily shareable advice to our members about what they could be doing to support their partners in Malawi. I think through these calls and the database of about 250 stakeholders active in this space, we've had some very detailed conversations. I think through the principles which are agreed and being disseminated, we've got a good sense again of the detail of what we would hope, how we would hope organizations work. But there's a sense from us that maybe there's a large number of our members, particularly community-led or small and medium-sized NGOs, that are still thinking we want to do something to support our partners in Malawi, but we're not sure what. And this is something, again, we discussed with DFID Malawi earlier on this week. So what we were thinking about was just trying to get 3 easy things that anyone with a link to Malawi can do, that most critically do no harm, as our first principle suggests. So we've got a suggestion of what those 3 call to actions might be for all of our members. The first is to work with their partners in Malawi to help disseminate information. You know, that challenge, how many posters in Chichewa and Chitimbuka can you have up in your local, in your partner communities around hand washing, around social distancing, that there's no way any harm could be done in that regard. Do turn to our website, where you'll see the resources page in the COVID-19 hub with all of the links to those posters. The second simple call to action we were thinking was about supporting the distribution, the production and the appropriate use of PPE, something that we've talked a lot about in this call and our previous Zooms. And the third is about support for access to the most basic practical equipment of sanitation and hygiene, so buckets and soaps. So those three that we're suggesting are disseminating of messaging, getting those Malawi agreed resources, posters, pamphlets out to your communities. Secondly, supporting the distribution, production and effective use of PPE. And thirdly, supporting the most basic practical equipment, buckets, buckets and soap and so forth. Time is now very short. We've, I think, run over our time for this meeting. So I think there's limited time to be able to seek input. But what we'll do is straight after this meeting, we'll send an email to all of our 250 COVID stakeholders, making that proposal that these are the three calls to action that we propose in the next phase, and give maybe a few working days through this week to seek members' input before, by the end of this week or early next week, we start to champion those three. So unless there's any really burning points, in which case please do jump in on the chat facility. If I may, Stuart, I'll move on to the next item, which I think was me as well. I'll try and, again, to condense with an eye to the time, if I may. And that is to sort of summarize what the SNP and MaSP has done so far and what we're doing, what our next steps are, before very briefly summarizing some of the key points from this meeting. So as you know, we host these regular Zoom meetings. In a moment, Stuart will do a quick online poll of those still on this call as to when you would like this next Zoom meeting to be. Just before this meeting started, you and all of our COVID stakeholders should have received an email with details about how you can join the Slack group. Some of you will know Slack very well. For many others, it may be the first time you've used it. It's a business communication tool that will facilitate member-to-member and member-to-stakeholder communications for all those working in this space, and really encourage everyone to sign up to that Slack group. And if you have any technical problems doing so, please do email Craig with details in that email. We've got the Web Hub, which will continue to update with news, information and resources. We've got the fundraising appeals, we've got perspectives, as Gemma CS said earlier on. Please do email us your perspectives and those experiences of your partners in Malawi, and we will upload them to the website, and the principles we'll continue to work with. We've got the working groups in both faith and youth and schools, and a range of other work there. So please do, after this meeting, if you feel there's something else that the SNP could or should be doing, how we can support your work in Scotland to support your partners in Malawi, please do let us know. I'm rattling on, but keen to get through these three items, if I may. And I think the very last thing, Stuart, that I was to do was to give a quick summary of some of the key points, if that would be helpful to do so now. If that's okay, super. Well, listen, it's as always been a real sort of a privilege and a delight to listen to all of these contributions. To have had upwards of 70 or 80 contributors in this sellout meeting, I think was absolutely excellent. Delighted to start with Dr. Mwansambo, giving the latest figures from Malawi. I think the three big challenges we heard from him was firstly, the challenge around the court injunction setting back the national lockdown. Secondly, the challenge around the way some of the political leaders have interpreted the messages there and are continuing to hold mass rallies. And thirdly, the increasing numbers of returnees from South Africa with potentially with COVID. But I thought good points of clarification to him, firstly on schools, that it's not firmed up yet, that 13th of July is when the schools will come back, but they will continue to be led by the scientific advice from the relevant task force. And this point that it's different to the Western model, that they're not looking for ventilators in quite the same way. And I think we were all reassured by that commitment to leaving no one behind from the government of Malawi. Thanks to Peter West, the Honorary Consul for Malawi for his message of support for what the SNP is doing in this space, and to Vera in Malawi for her update on the political side of things. And again, Professor Mipando came in there to say that perhaps some of the tone set by the political leaders in Malawi is also being seen in how the people of Malawi are responding to funerals, how they're gathering in funerals, and also how businesses are reopening or continuing to open. On PPE and testing, very pleased to hear from Professor Mipando about the range of different projects and cooperations and partnerships. I think most significantly that oxygen plant from South Africa with the Wellcome Trust funding coming online, and keen to remind people of what he said about the desire of the College of Medicine to hold an academic virtual conference in the next few months, and I expect there to be strong Scottish input to that. Keen also to flag that the point made around the use of the correct use of disposable masks in Malawi, with anecdotal evidence suggesting the advantage of a Chitenje mask is it's immediately obvious of how you wash it rather than a disposable one, which might be used again and again. On the faith side, my thanks to Eve Hartswood and to the Caruso Trust for their inputs there, the new prayer resources that are available and will continue to share through the SNP website, that engagement with 222 chiefs and community leaders, but critically the role that faith-based groups have in those ongoing relationships, allowing to work within the trust that's there. On disabilities, I thought Action Amos's points on the poor messaging to those with disabilities, with no braille or sign language, I think are important, and we will highlight. And powerful points in absentia from Olivia in 500 Miles about how the restrictions and social distancing are compounded for those with disabilities. On safeguarding, a reminder, the MaSP course, 15th to the 18th of June, with details on their website and in our bulletin and on the MaSP Facebook pages, and from Philippa Ramsden at this side as well on safeguarding. The principles, I'm pleased there still seems to be broad acceptance of them. Professor Eden's excellent point about the realities and the practical realities of the financial challenges that are there are very important. We will look to fine tune the wording to appropriately recognise those points. And Mike's Beresford point about the importance of two-way sharing in everything we do. Good examples of resilience and adaptation from Susan Flynn, from Professor Heather Kuby and Daisy as well. A number of good operational updates there. And finally, just ending by re-emphasising that point from Dr. Anne Poyer, the chair of our sister network, how important coordination and collaboration is. If you're doing something with Malawi, whether it's sending PPE or whether it's you've designed a new poster or you're offering financial support for a health clinic, the more that you can share information about what you're doing with the SNP and MaSP, the better we are able to give that national picture of what's going on, and the more coordinated things can be in Malawi and the more helpful Scotland is. A quick rattle-stop summary of the fantastic content that we've had over the last 2.5 hours. My final word, if I may, is just to say a big thank you to all the team, but most especially to Stuart Brown, who does the unenviable job of chairing these meetings with so many inputs and so much expertise at our tap, but so masterly. So Stuart, at the risk of making you blush, thank you very much. And Stuart, back to you to close the meeting. Thank you.
Thanks very much, David, for that really characteristically accomplished summary of everything that we've heard in a very wide-ranging manner as we've heard it. My colleague Craig has kindly shared on the screen an invitation for you to vote, as it were, in a poll. In real time, live, or to give us a snapshot of feedback. One, how you would characterise this event, how useful it was, from very poor to excellent. Has your teamwork been strengthened, supported as a result of this meeting? A binary yes or no. And just for us to get a sense of how long you feel it should be until our next meeting, between 2 and 6 weeks. We've been trying to hold these so far between 2 and 4 weeks, and try to accommodate the majority of responses, people who've come back to us on that. So if you would kindly click these radio buttons, then that would be much appreciated. I wonder then also if we might just do for social media a quick screen grab, if everybody was to turn on their videos, so that hopefully we get an array of thumbnail photographs of everybody, and we see who's made it until 3:27 UK time, 4:27 Malawi time. We've still got with us.
Stuart, thank you very much indeed. Thank you very much.
Thank you, Professor Eden.
Yeah, yeah. And to David, thank you. And Ruth, and everybody, and Heather, seeing at the top there.
You've dug yourself into a hole now, Tim. You're going to have to thank everyone.
I was going to say, where are they all? Yeah.
And Stuart and David, thank you very much for inviting College of Medicine. We are always happy to participate in this, and thanks for everything. Bye.
Thank you very much.
Thank you.
No, Dr. Mipando, in all seriousness, thank you so much for your time. It's a big commitment. Now, I know a colleague's very keen to tweet a picture of us all waving, so we're happy to have a quick wave, if that's okay.
Okay.
Very much. Great. Well, thank you very much, everybody. Again, we don't take your time and your involvement for granted at all. Everybody's very busy. It's much appreciated. We'll be in touch about the next meeting and with the key actions as per David's summary. So thank you very much, everybody. Do have a good day and take care. Thanks again. Bye-bye.
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 Bye-bye.